Hello, ladies and gentlemen. My name is Michael Kurtz. I am currently an applied medicine major at Indiana State University, and today I'm going to be talking to you about the glorious, wonderful uses of electrotherapy. I suck at editing. Imagine I put in a rainbow with electrotherapy across it. Just use your imagination. It's all good. One of the first things we need to talk about with electrotherapy is what exactly is it? Now, electrotherapy is the use of electricity to activate certain muscles throughout the body in order to promote a better healing environment for an injured muscle or tendon, ligament, whatever. First, we need to break down what exactly is electricity. I brought a picture. I'm pretty sure everybody knows what exactly electricity is, but it always helps to have a little visual key. So as you can see here, you have the electricity, the little lightning bolts jutting across there, going from positive to negative and positive to negative. Now, the reason I emphasize positive and negative there is because it's formed from the interaction between positive and negative charges. Electricity is essentially a form of energy that exhibits magnetic, chemical, and thermal effects. So it really encompasses a bunch of different areas of the healing process. Now, the first type of electrotherapy that I'm going to talk to you guys about is called a TENS unit. Now, this is a TENS unit. As you can see here, it's got the little handheld device, different things to adjust the current and everything. As you can see here, you have the two pads that are on this person's forearm. You have the positive there, the negative there, and it's essentially going to send an electrical current through those muscles right there. Now, what a TENS unit is a transcutaneous electrical nerve stimulator. It's a therapeutic device that delivers current to the body to cause sensory nerve depolarization. It essentially finds those sensory nerves, hits them, and it dulls out any pain. This is more used as a pain relief device rather than trying to activate any of the muscles. It essentially drowns out the pain by flooding those sensory neurons. It's a very low risk pain relief option, and it has also been shown to increase blood flow to those areas. Now, one type of disease that has been shown to receive great benefits from a TENS unit is Fowler syndrome. So if you know anybody with Fowler syndrome, they don't know what to do, possibly seek out a TENS unit for just a little bit of pain relief, help out that problem. Now, the next one I'm going to be talking about is the NMES. Yes, the NMES. I can't call it a NEMS or anything like that. It's just NMES. This here is an NMES. As you can see here, the device right there, it's not as handheld, not as portable, and it actually has 4 different pads that send those shocks through. So you have your positive and negative, and your positive and negative. It's going to send it throughout that whole area. Now, NMES stands for Neuromuscular Electrical Stimulator. It delivers a current to the body, but unlike the TENS unit, as we were talking about earlier, which just shocked the sensory neurons, it actually attacks sensory and motor neurons. So it's essentially going to cause a little mini spasm in those muscles. Essentially, it causes muscle contraction. So it's going to cause those muscles to tense up. Okay? So if it's in your forearm, it's going to hit those muscles right there and cause your fingers to curl up, essentially. This is used to reduce muscle atrophy in people who maybe aren't as active. You throw that on, it'll help shock those systems. Like if somebody's in a cast and they can't move their leg, it can help with that. It's also used to decrease edemas and muscle spasms after the NMES is no longer in play. Some people use it to increase muscle strength in athletes who are currently training. However, this has been disproven in multiple different studies. Some people still hold to it. I mean, it's really just It depends on who is using it, really. The next one I'm going to be talking about is the IFC. This here is the IFC. As you can see here, the person just kind of puts their hands on these pads, and there's the positive and negative, and it will send the electrical current essentially through the whole body, or at least from fingertips to the fingertips. IFC stands for interferential current. Essentially, it superimposes at least two medium frequency currents at the same time, hence why there's the two different pads. There's normally 4 electrodes. The type I showed you there doesn't really have electrodes, but essentially there will be 4 electrodes, and they will make a crisscrossing pattern to target a certain muscle of the body. This decreases tissue resistance, so stimulation is a lot less painful. Generally, when you use a TENS unit, you can kind of feel a little bit of pain. Nothing that will make it, nothing excruciating, but you will have pain. This essentially relieves that, and it also covers a much larger area than a TENS unit, because the TENS unit only had 2 different pads, whereas these have 4 that can cross. This is used for pain relief, motor nerve stimulation, and muscle spasm reduction. The next thing that I'm going to talk about is iontophoresis. Now, iontophoresis is a way of administering drugs through the skin using an electrical current. I just realized I used the wrong picture. Ignore what I said for IFC. That is not the IFC picture. This is the iontophoresis picture. Excuse me. So for iontophoresis, it essentially administers drugs into the skin using an electrical current. It'll normally inject the drugs into about 1.7 centimeters down into the skin. You normally uses drugs like hydrocortisone, lidocaine, dexamethasone, and acetate, generally for pain relief or anything like that. It's a much safer way and less painful way of administering these drugs, whereas if you had a needle prick, some people are really afraid of needles, and this can help relieve that. It is generally used to reduce pain with arthritis, plantar fasciitis, or TMJ, or temporomandibular joint syndrome, which I actually suffer from, so I can admit that it actually does help with that. It does relieve pain, but it doesn't target the source of the pain, so you still run into a little bit of a gray area there when it comes to actually fixing the pain rather than just relieving it. Okay, and the last one that we are actually going to be talking about is HVPC. This is kind of a weird picture. Bear with me. This is HVPC. You can see the pads there. You can kind of see it there. Ignore the nasty toes, but yeah, see it there. So HVPC is high voltage pulse current. Normally the high voltage part is around 150 volts to about 500 volts. Excuse me. It's a twin peak monophasic pulse current. Yeah, that's a lot. Twin peak, essentially, there's going to be two peaks of the current, so it's going to be giving that shock in different waves. It helps with pain modulation and edema reduction, muscle re-education in somebody who maybe lost some muscle use in forearm or leg, and it also promotes wound healing. It's most commonly used in geriatric patients. As you can see in that picture, it's kind of an older person's leg. I'm not one to judge, though. This is actually the only electrotherapy modality to produce wound healing. So if you, when used, it can actually help wounds heal back together. It has also been shown to help accelerate the initial healing phase of ankle sprains, which, personally, I suffer a lot of ankle sprains. Next time I have an ankle sprain, I'm definitely going to seek this out. The units are a little expensive, so I'm going to talk to somebody here at the university and hope they can possibly hook me up. Looking at you, Professor Kelsey. Hey. So yes, that is electrotherapy. There are 5 different types of modalities, and essentially they will help with muscle spasm reduction, edema reduction, pain relief, and just about anything you could possibly want in trying to heal a muscle. So yeah, that's electrotherapy in a whole. If you liked what I'm saying, you want to find more of it, like and subscribe. I'm here every once in a while when I have an assignment I have to do.